Since returning to power, US President Donald Trump has dramatically shifted American aid policy, not only by cutting overall aid spending, but also by adopting a far more transactional approach to development assistance. Over decades, African countries have received billions of dollars in US donor funding. A significant amount of that has been invested in the healthcare sector, saving millions of lives. The Trump administration has now developed a new approach to distributing this aid to African countries. The America First Global Health Strategy involves bilateral deals tying funding to concessions from recipient countries, among other benchmarks. The US government says this is intended to end dependency by pushing governments to assume greater responsibility. The US Secretary of State, Marco Rubio, said the US, with this new strategy, will, quote, cast a positive vision for a future where we stop outbreaks before they reach our shores, enter strong bilateral agreements that promote our national interests while saving millions of lives, and help promote and export American health innovation around the world. Now, the US says 17 African countries have so far signed these bilateral deals. So what does that mean in hard numbers, and who is on board? These are the countries. And for them, the bilateral agreements could mean a total of $16 billion over the course of the current Trump presidency. Now, we want to take a deeper dive into three of those countries, Kenya and Nigeria, which have signed up, and Zimbabwe, which has halted negotiations on the deal at the end of last year. Now, is the America First Global Health Strategy less about medicine and more about mining data and mining minerals? MAGA gifts seemingly come with strings attached. Recipient countries have to contribute their part of the bargain in hard cash, but also in giving the US access to medical data of their citizens and the rights to access minerals. That's become clear in Zimbabwe's response, where the government has become the first to say a clear no to the deal. Here's part of a leaked government letter written back in December, and I quote, President Emmerson Mnangagwa has directed that Zimbabwe must discontinue any negotiation with the USA on the clearly lopsided MOU that blatantly compromises and undermines the sovereignty and independence of Zimbabwe as a country. So, are there worries that this will have negative consequences for the relations between the United States and Zimbabwe? We put that question to Nick Mangwana, the spokesperson for the government of Zimbabwe.
Well, look, we have a good relationship with the United States. Today, the ambassador was actually at our Ministry of Mines looking at bilateral cooperation in the mining and mineral sector. So we will find each other in the areas of convergence and continue to work with them in those areas for mutual benefit, and in areas where there is convergence, where they win and we win. We want a win-win for both countries. So they are right to negotiate the way they are negotiating because it's in their best interest. They are putting America first. But we are also right in the way we are negotiating because we are putting Zimbabweans first. So that's where we are at. There is no diplomatic tiff between the two countries. There is no problem between us. It's just one transaction which you got to know of because somebody leaked something. Otherwise, we are always in negotiation over one thing or the other. There are so many MOUs that are being negotiated between our countries. I think the worst thing that happened here is that diplomacy went to the public arena, whereas diplomacy, by its nature, should be between the concerned parties.
We can now also talk to our correspondent in Harare, Privilege Mushranyiri. Privilege, it's good to see you. Tell us more about the terms and conditions Harare had to meet in exchange for US funding, specifically the biological data that the US wanted from Zimbabwe.
Yes, Christine, hearing from government officials, particularly the Permanent Secretary, Mr. Mangwana, what they are saying is that the government had been asked to share biological data over an extended period with no corresponding guarantee of access to any medical innovations. And this, the data that they were asking for included pathogens, some researches, and even samples maybe that could be obtained from Zimbabwean citizens over time that they would then use for research, maybe for developing vaccines and different kinds of medicines. So this is what the Zimbabwean government is now saying, that they were not prepared to release such data to the US government for such purposes, and therefore that's what led to this decline and even refusal to settle down to this deal.
Yeah, and refusing to agree to this deal. There's been a statement released by the US Embassy in Zimbabwe saying that the US will now begin winding down its health assistance in Zimbabwe. How much does Zimbabwe depend on this assistance?
Significantly, there was a significant dependence on international assistance, particularly from the US government. The US government was funding a lot of HIV and AIDS programs through PEPFAR. And they were also funding things like neonatal programs. They were also funding different researches that were also being done in the country, particularly the antiretroviral drugs. And they recently introduced lenacapavir, the injectable HIV and AIDS drug, the PrEP drug. So this was highly subsidized by the US government. And now that the US government is winding down, these programs are bound to be affected, and the funds that were supposed to be coming to the tune of 350 million US dollars were meant to be going to these programs. And now with this disagreement, the withdrawal coming, there is that issue now that these programs may be affected if no funds are availed to plug the gap.
Yeah, and Privilege, just give us a sense of if the president, Emmerson Mnangagwa, has broad support for his decision then not to take up this deal with the US for health funding. How do Zimbabweans feel about this?
Many Zimbabweans have commended the government for doing this. If you look on social media, a lot of people have been coming up saying that it is commendable because it is unfair to obtain biological data with no reciprocation, because remember, what has been happening in the past is that cooperation has been coming through the World Health Organization, but now with the US withdrawing from the World Health Organization, it is now going directly to nations to ask maybe some of these things that were being done under the WHO. So Zimbabweans have been commending the government for doing this. Of course, some critics are saying that how do you go ahead and do that when you have had a partner that have been funding some of your programs, looking at how the public health system is in Zimbabwe. It's not well funded, and it has been funded largely by donors, and the US government through PEPFAR and in the past the US aid has played a big role. So it's kind of a mixed bag, but largely Zimbabweans have commended the government for doing this, because they were saying that how could we secure our data, especially the biological data that then goes in the hands of the US researchers or government, and what is going to happen after. People were very skeptical about that.
All right, that's our Privilege Mushanyiri in Harare for us. Thank you, Privilege. Now, Kenya was the first country to sign a bilateral health deal with the US, and one of the few to make the deal public. It also rapidly became the first country to see significant resistance to it. Signed in December, the deal was halted by a court just a few weeks later over the lack of parliamentary oversight, and a part of the MOU that allows the sharing of Kenyan health data with the US.
The framework we signed today adds momentum to my administration's universal health coverage that is focused on supply of modern equipment to our hospitals, efficient and timely delivery of health commodities to our facilities, enhancement of our health workforce.
It's an honor to be able to do this with you today. I'm excited. This is our first one. We hope to sign, 30, 40.
There's been a huge shakeup in global aid over the past year. The US shut down USAID and pulled out of WHO.
We have closed the USAID group to eliminate waste, fraud, and abuse, which was tremendous waste, fraud, and abuse. And we're working tirelessly to forge new economic opportunities involving both the United States and many African nations.
It is clear we would love to see the United States be a full participant in the work of the World Health Organization. Viruses, non-communicable diseases, all of these issues need and should be worked out with international cooperation.
The US sees the country-to-country health deals as its alternative. The first was signed with Kenya in December last year.
So what do African governments and the US get out of this? Dr. Githinji Gitai is a public health expert and CEO of the medical NGO AMREF.
On one side is good because it provides much needed resources for the countries to continue supporting their public health systems, which have been negatively impacted by the rapid decline of development assistance by the US government and other governments as well. Now, the questions that come about this then become the questions around, one is the questions on sovereignty. And I think that's where most of the issues of pushback in the countries are. Because the US in the bilateral is actually presenting a transactional approach.
And here's where the deal hit a snag in Kenya. Two separate petitions resulted in the High Court putting the deal on hold. Their reasons that Parliament and other stakeholders were not consulted and that the agreement to share Kenyan health data might contravene the country's data privacy laws.
And in this particular case, the argument is that health data belongs to the individual, not to the state. It cannot be aggregated, cannot be collected, cannot be traded in, cannot be exchanged without the express consent of the affected individual.
Civil society groups had also raised the alarm. They pushed for the Kenyan government to make public both the deal and the data sharing agreement. And Kenya's president assured people that the Attorney General went through the agreement with a tooth comb.
Alan Maleche and his NGO Kellen, which works on legal issues around HIV, was part of a group of organizations who lobbied on the matter. And while some of their initial fears were calmed, like the fact that the data will be anonymized, some concerns remain.
Should there be a conflict between the Kenyan government and the US government? What recourse do I have as a Kenyan? And if anything happens to my data, it's difficult to know how I will be able to hold them accountable, because there's a clause that says they still enjoy privileges and immunity, which means you cannot bring them before a Kenyan court to hold them to account, and you cannot go back to their country to be able to hold them to account.
Speaking to local media, Kenya's Principal Secretary for Medical Services explained, it's already part of the international health regulations to give aggregated data to, for example, WHO. So now, because the US is not going to be part of that mechanism, they want their own mechanism.
Other aspects are changing too. The US is more hands-off and planning to do less implementation on the ground. US health policy expert Stephen Morrison sees Kenya as one of the US' preferred partners, but says there are still many uncertainties on how the deal might be rolled out.
This new model is trying to act on criticisms that have been made for many years of our global health programs. There's questions of whether the timeline is too aggressive and too optimistic. There's questions of, will they really be able to control for corruption and the like? Will these governments really live up to their commitments? Will the US government have the will to really live up to its claim that it's going to enforce these commitments. All of that is still out in the future.
The US Department of State told DW that they do not disclose the details of private diplomatic conversations. Their America First strategy, however, says it wants to keep Americans safe, which is why they still want data on disease outbreaks. It also states that it is a strategic mechanism to further our bilateral interests around the world.
When the bilateral agreements are being done, they are largely transactional. The America is saying, what is it we can get from this country? And once they determine that, they then say, for this, we'll give you this money. That's why you've seen in some countries, it's an exchange with minerals. We'll give you the money for health, but we want access to those minerals. In Kenya, we think it's data and also Kenya's diplomatic and security positioning in the region. There's a big diplomatic trade-off here because Kenya is really well positioned for anti-terrorism in the region, in the Horn of Africa, and it's a hub.
The Kenyan court halted the deal with the reasoning that if the deal is indeed unconstitutional or in breach of data privacy laws, it needs to be examined before it is implemented. The next court date is expected in April, and after that we might find out if these agreements are really watertight. Until then, both governments will have to bide their time.
Now, among these 17 countries is also Nigeria. It has signed the biggest 5-year deal with the US, with more than $2 billion in aid. It's aimed at boosting HIV, TB, malaria, maternal and child health programs, with a strong focus on expanding Christian faith-based healthcare. That's according to the statement by the US State Department. Now, Nigeria, in turn, will increase its own health spending by nearly $3 billion, the largest co-investment yet under the America First Global Health Strategy. And for more on Nigeria's 5-year bilateral health memorandum of understanding with the US, we can bring in our West Africa correspondent, Azizat Olaoluwa in Lagos. Azizat, what is known about the health deal Nigeria has agreed with the US?
So we know that the U.S. is going to provide $2.1 billion, while Nigeria is going to balance it up with about $3 billion, totally 5.1. And that is going to be for the period of 5 years. And this funding is to help the country, Nigeria, to shore up its health capacity, especially in providing access to affordable, curative and preventive services in HIV, AIDS, polio, malaria, tuberculosis, and even maternal and child deaths. It will also help the country to improve its surveillance and data systems and also improve the capacity of the frontline health workers.
There have been some concerns raised about the transparency of the deal. Can you tell us more about that?
Absolutely. And that started when the official statement from the Nigerian government came out and left out an important detail, which we saw in the statement released by the United States Embassy in the country, stating that Christian-based faith clinics are going to get preferential treatment, so to speak, because they're going to lay emphasis on them and by providing about $200 million funding in the 5-year period, because they believe that they play a crucial role in providing health services in rural areas. And there have been questions about the transparency on the part of the Nigerian government, which intentionally left out that information that could have, hit up the polity, so to speak. And that has generated lots of reactions, especially from health experts and activists in northern Nigeria, which is known to be predominantly Muslim.
And as you said, to what extent is Nigeria dependent on US donor funding for public health services?
Well, I can tell you that Nigeria is highly dependent on US donor funding, and the United States is the top donor in Nigeria, especially in the health sector and in humanitarian aids as well. And in 2025 alone, the US was able to provide up to $500 million in helping Nigeria, to improve its services, especially in PEPFAR, aid funding, HIV/AIDS services, and other aspects of its health sector. So this bilateral deal, according to many, from what they're saying, is just another step, really, in the U.S. moving closer in its bilateral agreement with Nigeria.
The America First Global Health Strategy is seeing countries signing up, but it is also seeing pushback. Could you tell us more about that?
Absolutely. As of Wednesday, about 17 African countries have signed that health MOU with the United States. And like you said, we are seeing pushback. And the latest, before I get to the pushback, let me tell you about the latest country that signed here on Wednesday, and that was Burkina Faso. And Burkina Faso, the United States has promised to provide about $147 million in health funding for that country, while the Burkina Faso government is going to provide about $107 million also for the five-year period, as the U.S. gave to most of the African countries as well. And that is to help to improve health security in the Sahel region, and also empower the Burkina Faso government to be able to independently, control the outbreak of infectious diseases in its country.
And the pushback, Azizat?
Okay. Yeah, and to talk about the pushback, Zambia is one of the latest countries to be pushing back against that the MOU deal U.S. is making with African countries, saying that it's not representative enough, so to speak, because health experts in Zambia are saying the U.S. deal has mining access that would favor the United States, and also data sharing access as well to the United States, which they believe that is not really transparent enough, and they have called for more revisions of that deal before they can move forward with it.
All right, that's our correspondent in Lagos, Azizat Olua. Thanks very much for your reporting. Now, returning to Nick Mangwana, the spokesperson for the government of Zimbabwe, we asked what it would mean for the country if the US pulls its funding out of healthcare there.
We prefer that they wouldn't have done that, but they've got a sovereign right to make that decision, so we will respect the decision, and we will have to find the resources from elsewhere and channel them from elsewhere to put them in the health sector in the areas that they were covering. We appreciate them for the work they've done and for the support that they've given over the years.